Welcome everybody to our Health and Science Technical Qualification. So that's our healthcare science and science, where we're going to explore lessons learned from delivery. So for those that I haven't met yet, although by looking at the names, I think I've met quite a lot of you, but for those that haven't met, this is just a bit of background of who I am, and then we'll move on to looking at what the agenda is in store for us today. So I'm the Provider Development Officer for NCFE. I support and develop educational providers. My main focus and all I focus on is the T Level Health and Science qualifications, and it's CPD events like this that we explore and support providers. Before that, I was a teacher in health and social care, and prior to that, I was also a teacher in psychology. So that's my background, and I have brought sort of that experience and explored that experience, and then thought, right, what do our educators need to know, and how can they apply everything that they already have, that great knowledge, to the T level and help support providers in understanding that. So this is our agenda for today's session. We'll do a little bit of housekeeping. We'll make sure that everybody is able to get onto Slido, because we'll be using that for our interactive sort of components. And then, as I mentioned, we have a great list of speakers. So from James from Chichester College Group, Philip Chrich, Kieran Fowler, we have Gina, who's going to explore healthcare science, and then we're also joined by Matt and Simon as well for NHS insights in regards to T-level placement. Unfortunately, Kim was poorly and wasn't able to attend today, but we've got some fantastic insights shared with Matt and Simon. We'll then close with a Q&A and some feedback and some final sort of polls. So mics are available for you to control. I will mute you if the speaker's speaking and you've accidentally come on. But other than that, it is for you to control when we ask questions and from a Q&A point of view. This session is recorded, so for your own privacy, it's up to you whether or not you would like to have your camera on in that regard. I'll let you control that. Just a reminder that we can't discuss the previous summer series. The results are not out until August. We can definitely have our one-to-one support call in CPD where we can explore those assessment series after the August results day, but no discussion of those specifics that are in there until obviously results are released. It will be an interactive session, and we have got the use of Slido. Just a little bit sort of the best practice around asking questions when we have multiple speakers like this, just so that you are heard and get your questions answered. So each speaker does have their own time slot, and in that time slot, if there is time, we will ask questions, answer any questions. If we run over a little, we'll move to the next speaker, but our speakers will answer any questions directed to them in the chat. And then at the end, as I mentioned, we do have that time for a Q&A session also. So let me just get this link ready for you to join for the Slido, and I'll pop that in chat, and then I'm going to pop a QR code up for you all. So in the chat is our Slido, and then which one am I looking for? This one. There we go. So you can either join with the link in the chat, or you can utilize your phones and scan the QR code, or you can join us on slido.com and put in the pin hashtag NCFE. And hopefully you will all be able to get on through those different means, and then just keep that window active either on your PC or on your phone, and as we move through the polls, it will naturally move to the next poll for you, so you don't need to log in each time. Another few seconds, and then we're going to move to our first questions. Oh, that's not great. Okay, and let's go for our first question. So what strategies have you found, so this is your first opportunity to share what you've learned, most effective in keeping students engaged and motivated throughout the T-level programme. And I think this specifically, I think year 2 students are all like, yes, I love this, I'm at OS, I'm doing great. But year 1, I think, is the one where we really need to keep that student going and getting them to the second year, getting them through exams and content that they're brand new for them. So what do you do to keep students engaged and motivated? And you can share that with your peers. I'll use examples before they try the tough stuff. I love that, the tough stuff. What are the tough stuffs? Role plays, practical activities, linking to their personal career progression paths. I love that, and plans, practical work. Absolutely. And some of our speakers are going to share how you can bring that practical work to life both in year 1 and year 2. Regular formative assessment with detailed feedback. Brilliant. Guest speakers, yes, work taster activities. Yeah, and I imagine these guest speakers go beyond that placement. It's bringing that content to life, and I think that's great from when students hear from people in the industry, they can really link to that really effectively. Use of case studies to solve health conditions. Oh, where's my mouse gone? There we go. Lots of interactive sessions. Just starting, so don't know yet. That's absolutely fine. Hopefully you're getting a nice range of ideas from everybody. Guest speakers and skills masterclasses. I love that idea of a skills masterclass. Mixing up the lessons, so no lesson is the same. Use practical demos and relating content to real world example, and the news, definitely the news. COVID is still a great one to link to, that's in our students' real life experiences, and it is super great for both content for, say, diseases and looking at bacteria and viruses and how they all change, and looking at epidemiology to infection control. There's a nice range of ways to make those real lived experience of your students really link to the content. Excellent. So you can see practice is the top one. Yeah, absolutely. Practice and practicals. I imagine guest speakers. These are sort of our top sort of experiences. So that's fantastic. Thank you very much for sharing those. So now I'm going to move on to our first speaker, Gina Tito. She is our NCFE Senior Projects and Contracts Manager in Technical Education. She leads the T-level program team. She's a certified project manager. She recently moved from UK, from New York, and she's got a fantastic accent. And she has real experience that she's brought to NCFE, and then she's going to share some of her great insights. Thank you.
Thank you so much, Tracy. And thank you everyone for being here today. I'm going to try and breeze through these because I want to hear a lot more from you and from our speakers. As Tracy said, you can probably tell from my accent that I'm new to both the UK and to NCFE. I joined in January 2024. And my background is in education and project management. My father was a scientist, and so I think the fact that I'm working on T-levels and this real focus on healthcare science and science, I think he's finally proud of me for at least approaching, the scientific field. So I'm really, really pleased to be able to spend this afternoon with you. You all know that T-levels are a new qualification that are based on the same standards as apprenticeships. And I'm sure you also know that they're a unique and novel credential and qualification in some really key ways. But I think it's an important reminder to all of us that we're really on the forefront of innovation in education and in assessment. The T-level design in partnership with employers and with our T-level centers such as yourselves is really new. And so we're really pioneers in this work together, and we see you as real partners in helping us learn and adapt. This is what this session is all about. This is what the development and the continued redevelopment of T-levels is all about. These are also new qualifications that are different for NCFE. The governance and ownership of these qualifications by the Institute for Apprenticeships and Technical Education, which we refer to as the Institute or IFATE, is a really new way of working for us and for us as a business. A really big part of my role is to manage that partnership, NCFE's partnership with IFATE. And we work collaboratively to develop and manage the growth of the T-level program, as well as collaborating with other awarding organizations who deliver the T levels. NCFE currently manages 6 different T-level contracts on behalf of the Institute. So that's education in early years, digital business services, digital support services, and then of course our healthcare science and science T-levels. Now there's certain aspects to the work that we do and the work that my team does on T-levels, which is common across all of the contracts and all of the qualifications. But there are also elements and aspects to our work which is unique to each T-level and with each sector. And that's why we have wonderful experts like Tracy and her team here at NCFE to support our partners and providers to offer the best quality teaching, learning, and assessment experiences to these early cohorts of T-level learners. If we head into the next slide, I thought it might be worth spending a little bit of time just looking at the T-level action plan that was issued by the DFE in April of this year. My apologies if you have already reviewed this document in a lot of detail, but as you're likely aware, this is an annual plan that is issued by the department, and it provides us with an update on the rollout and take-up of the T-levels, as well as potential policy changes. It also includes a useful range of qualitative and quantitative data, including T-level foundation year stats, and it also links to the 2023 learner survey from the first cohort of T-levels. So definitely worth a read if you're able to add it to your reading list. One particular update that I thought it would be helpful to draw out today is the aggregation of core support materials for T-level providers on a single website. So this is covering Gatsby, awarding organizations, its comms plans, it's a centralized place to gather newsletters and bulletins. I know that one of the links that I've bookmarked to take a look at later is the Institute's occupational maps, really just to build my own understanding of how this evolving ecosystem is supporting our T-level learners in their progression to careers. So I'm going to be taking a look at that myself later on. Another key update that I want to draw out today is the announcement that over the next 12 months, the DFE and the Institute, alongside Ofqual, is undertaking a route-by-route review of the content and assessment of all the T-levels on an individual basis. And we've really welcomed this review that's really initiated by the Institute and the department. It's an important example of how the T-level program, in the T-level program, we're working to take on lessons learned from the early delivery of T-levels and embed those lessons into the future contracts that are going to be awarded in the coming months and years. Where NCFE fits into this process is through our engagement with yourselves. So I'm here to listen to all of you today and take those lessons back to my conversations with the Institute, and through sharing our own perspective as an awarding organization, what we've learned about this process and sharing that with IFATE as well. Lastly, the action plan shared a few key dates that I hope are already in your diaries. The 2nd to the 6th of December is the T-level celebration week. The highlight of my annual calendar. I've blocked out my whole week. Can't wait, counting the days. And also the fact that the T-level awards are going to be embedded in the National Apprenticeship Awards, which is a really exciting development that we're looking forward to celebrating all things T-levels. Now, the last slide that I've got here, and then I'm going to turn it back over to all of you. I wanted to end on the slide, which is what keeps me starting each day with a smile, which is really about the stories of impact of the T-level program. On the NCFE website, you may have seen our celebrations of our Aspiration Awards, which I would recommend a watch of all of those videos, a really, really wonderful celebration of learning. But we also have a number of case studies from centers and learners who are at the heart of our work on T-levels. We've got a learner story from Anna Cisse, who studied at Tresham College, who talks about how her placements and preparation from the T-level provided her with those first critical steps into the healthcare sector. And I know we have so many other center and sector experts on the call today to bring even more insights from their first 2 years of delivery. So thank you all so much for all the work that you do on behalf of learners each and every day. It's not easy, and I can't wait to hear insights from you all in the rest of today's session. Back over to you, Tracy.
Thank you. Thank you very much, Gina, for sharing that. That was really insightful. And I think it's great to get that context about NCFE and AOs and even DFE and IFATE, how we're always continually reviewing and exploring lessons learned and using your voice as providers to help make these qualifications as best as possible to support your students' outcomes and progression. So that's really fantastic here. Thank you, Gina. So back over to you and to share some of your experiences. Can you share examples of successful partnerships that have enriched the T-level learning experiences? So who have you worked with? So those specific, who have you worked with, which employers, their universities, industry speakers, who have you brought? Because you talked about that, we brought speakers in to share and bring that to life. Let's explore some specific examples, especially for those that are new. To T levels come September who are on this call, and they can really share that and experience that as well. So NHS, fantastic. Yep, excellent. Yeah. Our top employers. Science Council, yeah, really, really great. And it's such varied from Anglian Water to the NHS. So you've got local and national employees there that are engaging your students. Unilever, yeah, absolutely. Yeah, Silko, can you please put the dates for the T-level week in December in here? Absolutely, Gina will pop that in the chat for you, Silko. Ah, already there, thank you. Local hospices, BCU. So we can see here a nice range from across the country, and hopefully this is going to give you some real ideas about actually who could we engage that goes beyond placement, even that we can bring into the classroom. To NHS trusts. Oh, so you're lucky to be in an area where you can engage multiple NHS trusts. That's fantastic. But you can see there, I think the top one is the NHS. This is our top employer, and this goes beyond just health. And I know we're going to have quite a lot of health providers on here, so this might bias it a little towards the health side of it. But we know that our NHS is one of the biggest employers, not just in health related quals, but across many industries. And you will see from science to healthcare science, your students are going to be at some point most likely employed by the NHS or experience working with the NHS as a stakeholder. So absolutely is probably our main employers. So fantastic. Thank you very much for sharing these. I'm hoping that other people can get some ideas about where else that they can engage employers for their students and outcomes. So I'm now going to pass you over to James Waters and his colleague Kira Williams, and they're going to share their experiences from Chichester College Group, both from a health and science TQ perspective. He works across 7 colleges as part of the college group, and he has great, fantastic experiences, both James and Kira, to share with you, being a Wave 1, if I remember rightly, a Wave 1 provider. So they've been there since the very beginning, so and can really share those insights about what they've learned, both the positives and where things maybe need improving year on year as well. Thank you, James.
Thank you, Tracy. Hi, everyone. My name is James Waters. I'm the T Level Development Manager for Chichester College Group. I've also got my colleague with me. I'd like her to introduce herself as well.
Hello, good afternoon, everybody. My name's Kira Williams, and I'm James's deputy on the T Level programme.
Next slide, please. So Tracy actually touched on the fact that we are part of a 7 college group, and you might be thinking, well, that's quite big, but sometimes it's just nice to kind of visualize what that actually looks and maybe feels like. So T levels very much began at Chichester College and Crawley College, but as we've rolled out T levels as per the national rollout of T levels, we've now started to implement those into other colleges within the wider college group, which is fantastic. So we really do feel like they're here to stay, particularly in health and science, and we have, large amounts of interest from prospective students, parents and employers. So we're really pleased with how it's going. But yeah, we're going from strength to strength, and it's just nice to be able to share, that we're one big family, and we are, working together collaboratively to make this work. So what I wanted to do is just kind of give you a flavour of our journey from implementing T levels and some of our early experiences of delivering. So we actually started the first available option to deliver T level health in adult nursing in 2021 at Crawley College. So I'm going to share a little bit of information about that with you shortly. Kira's going to talk about science. So we've been delivering laboratory sciences since September 2022 at Chichester College, and also talk about some of the industry placement work she's been doing with her team and in partnership with one of our speakers that's on the call today as well, Matt Holmes. And then we'll finish up with talking about health, adult nursing that we've introduced at Brighton Met as well. So, you know, we've got off to a good start there, considering we only merged with them a couple of years ago. So we're in quite a good position. So T Level Health at Crawley College. That image I've got on the screen is actually our simulation suite in the Longley building at Crawley College. So if you ever want to come and visit and want to check it out, let Kira and I know, and we'll be more than happy to show you around. It's a fantastic space, and we've worked really closely with the NHS using some specialist equipment allocation. We're very lucky and fortunate to get that grant from the Department for Education to enable us to create a real life working environment for our students. So not only are they learning about the core content and preparing them for assessments, we're giving them access to this facility to really hone in on that knowledge and develop their skills to make sure they're feeling confident, not just for their assessments, but probably more importantly, the industry placement, to make sure that they're there on time, have those employability skills and can perform in a team and actually do a good job. We recruited a small group of students in 21-22. So we had a feeling that we'd be quite a small group to start with, because there wasn't that much awareness of T levels in the very early stages. We were really pleased to get a group off the ground. All the students that we did enrol started their industry placements in a local hospital within the Crawley College demographic, and that was, you know, absolutely big thanks to the NHS for enabling us to partner with them to plan that activity within their study programme and to give them a fantastic experience and really focus on those technical learning objectives that they're able to work towards and demonstrate progress and make a real difference to the time that they spent with their employer. I think it's important sometimes to highlight some of the challenges. So I think it's honest and useful just to kind of not sugarcoat everything, but to make you realise that there were some challenges. So in 2022, the core papers did present some of our learners with some difficulties, and actually the results that were issued were a bit lower than that were expected in August 22. So we actually decided to defer the qualification and actually give the awarding body the opportunity to kind of work on the feedback that was provided, and actually as a result of that the specification was updated, which was fantastic, and we are actually reintroducing this T level in September 2024, and we've got a really large group expected to enrol. So actually sometimes it's important to kind of recognise the challenges, feed that back, and to kind of reassure you that the awarding body really do listen and take on board, you know, any concerns that you might be encountering, and to get it right. And as I've said earlier, you know, it's important for us to, you know, kind of learn as we go as well, because they are still new qualifications. Over to Kira.
Thank you, James. Yeah, so we've been doing the T level science. We're in our sort of second year of delivery on that now. We've got students that are going to be qualifying this summer. We have had some really good positive experiences. We've been supported by the NCFE with all the different resources that's helped with our curriculum. We've had our placement settings that the NHS have been very instrumental in providing for us, have been excellent. Actually, we've been really fortunate. So we had a cohort last summer who did 7 weeks throughout the summer holidays at the labs, and they did a rotation through all the different departments. And I have to say, it was just such a fantastic experience for them. They've also since been offered bank work, all of the cohort, which is again sort of amazing. Can I just say though that it was a long time in the making. We had to go through quite a few hoops and quite a lot of planning and preparation and sorting out the onboarding, which was, I know Matt will agree with me, I know he's on the call, was quite challenging, but we did get there. And actually our plans going into this coming September for our placements, we've managed to really sort of tweak that. So I think working really collaboratively with your employers and being really transparent about the challenges and working together to get over them has been sort of, you know, really sort of the reason why it's succeeded so well. Some of our students have been part of a video promotion for the NHS. And one of the other things that we had actually that was really positive was for our health students at Brighton. And we had workshops that the NHS delivered on a Friday, I think it's, yeah, term 2. And we had 5 weeks where different the trusts and that came in from the NHS, highlighting all of the opportunities that were available, as well as some interactive workshops. And that, again, was fantastic for the students because it just made them realise the sort of the amounts of vacancies and the detail and the different job roles that are available, you know, was great. And in fact, it was actually picked up by an Ofsted monitoring visit that this was really, really good practice. And, you know, we were praised for that, you know, to getting those employers involved with our students as soon as we possibly could. So I think that's a key thing. It's getting those work taster activities and those guest speakers in, because the reason that students come onto the T Level program is very much for that sort of practical side of it and that hands-on. That's the hook, you know, that's the game changer. And I think as soon as you can get, you know, those employers come in, it kind of like keeps them engaged and keeps them, you know, alive really, you know, and sort of motivated. And it definitely impacts on that, you know, sort of retention. So yeah, we were, you know, like I said, we were very lucky. One of the other things we had, and I think was a result of the placement, was our ESP grades were very high. And I think because they were able to relate their placement experience into that sort of assessment, you know, and make it again sort of real. So yeah, again, it was yeah, it was good. So those are all the positive experiences. So the challenges that we had was on recruitment, we ended up with quite sort of smallish numbers, 7 or 8, because lack of awareness and you know, just generally, I think nationally for T levels, you know, I wish I had like even a penny for each time I had to explain what T level was. It was like, wow, you know, there's just, you know, and I think there still needs to be more. Still not enough. So that was one of the challenges, and obviously where the ESP grades were really high, our paper grades were lower than expected. But again, I think that was something that was experienced nationally. So I don't think it was literally, you know, our college group. But all in all, yeah, it's been really great. And you know, thanks to Matt and his teams, you know, for creating those opportunities for our students. And yeah, looking forward to next term.
Thanks, Kieran. So I'm just going to wrap up with actually our most recent T level that we've implemented is actually T Level Health Adult Nursing at our Brighton Metropolitan College, which is part of the Chichester College Group. So I just wanted to kind of share some kind of key tips really. Some of this you may be aware of already, but just from our experiences so far, you know, can't recommend enough to use the full guided learning hours. We decided to front load the teaching in the first year, and students really do need that input to prepare them for the employer set project and the 2 core exam papers at the end of year 1. I know there's the option to decouple, but for us, we feel like this is the approach that's working, and we've standardised it across the group. Revision techniques from day 1. You know, some of you come up with the ideas earlier, but quizzes, any form of technology to keep students engaged, to refresh student knowledge, and just getting them feeling confident in being able to recall information on the spot, and almost becoming like a good habit. That independent self-study will then, you know, kind of thrive outside of the timetabled hours as well. Asking for at least grade 4s and above in science, and actually making sure the students understand that paper B is science, and they do really need to like science as well as a subject. So it's just thinking about that information, advice and guidance that you give you know, open events, when you've got them in for tasters, and when you're interviewing prospective students as well, just to make sure they're making the right decisions and informed choices about what T level they'd like to do. The employer set project does involve more staff than you may realise, and this is mainly around the role plays, the presentations, and discussions, just making sure that whole process is smooth. And just be mindful, obviously, about technology when you come to upload the evidence, just making sure that what you have is compatible when you're able to upload that in line with the conversion to the online portal. So just factor that time into your planning. It's just really helpful to build that in. And as Kira said earlier, you know, placements do take time to organise. It's not work experience. Industry placements are really a completely different product. So it's just thinking about the bigger picture. You know, you'll be used to things like DBS, but you know, the implications that might have if they're not back in time, and have you got a plan B? Having good links with settings, like Kira said, you know, it's really important to build those relationships and give it time. You know, don't rush a placement if you're not ready. Make sure you're both happy, and once you've got that delivery model in place, you know, there's no reason why it won't be a success. Getting block weeks in early to bank hours, you know, I can't recommend that enough. There is sometimes a focus on trying to get day release placements, and actually what we realised is there isn't really one size that fits all. So it's trying to make sure you have a delivery model that works for your curriculum, and how you sequence the learning as well. Think about what content you're going to be covering and when you feel like students are going to be at the right point. There'll be some learners that can go out sooner and some that might need a bit more time. NCFE are helpful. Ask questions, use the resources in the Crawl Hub. There's other really useful resources in TES, Zigzag, and Tutor that we've purchased. And you know, if you really want to kind of, you know, add to the sample assessment material that's available, I can't recommend any of those enough. And create a network. You know, yes, we're part of a college group, but actually some of our biggest learning has come from working with other colleges and sixth forms and schools, and getting onto social media as well. You know, Facebook have groups. There's lots of WhatsApp groups that are set up for teachers, and they're a really good way to share, you know, challenges, but also to share good practice and ideas and help one another. Thank you.
Thank you very much, James and Kira. That was really fantastic. It was great to hear about some of the wonderful successes that you've had as a group. And I'll pick out one thing about summer placement, Kira. I think that's really great to share that, because a lot of our providers are like, oh, they can go out in the summer. Absolutely. As long as you've got, from a health and safety and a safeguarding point of view, a contact there at your centre for those students, both for the employer and the student, then absolutely utilise. It's a 2-year programme. So definitely utilise those full 2 years, because you don't always get a say on block placements, and it's nice to have that as a negotiation as well with your employer, to be able to negotiate and say, well, actually, we're going to give our students options available across the 2 years for placement. But again, I imagine it's making sure that you're having those conversations with the parents as well, and setting that expectation. So thank you very much for sharing those ideas. Do we have any questions? I'd like to definitely pick any questions up now. If anybody has any questions for James or Kira, please feel free to unmute your mic, or put them in chat. And if we don't pick them up now and you think of something as you go through, we'll definitely pick them up in the Q&A session as well. So I'll just give the person a moment. No, I think you've covered everything really fantastic, James and Kira. I think everyone's gone, no, actually, you've answered all my questions. I'm good. I'm absolutely brilliant. So that was really great. So thank you for that. Now, I just wanted to move into so I've got one from Derek. How would you advise practicing questions for exams? So this can come from James or Kira, but how would you advise practicing questions for exams? What do you think?
That is a good question. And as I said earlier, we're still learning, but from what we've tried and what has worked for the students that we've had and we have, you know, it's just that regular testing, quizzes, weekly exposure to, you know, mock questions. We actually build in something called fixed progression points. So we have like formal testing as well, so we can actually track how they perform and identify perhaps where they may have gaps in learning, and then we can really focus on how we can close those gaps with those students individually and tailor the support to meet their needs. But we do actually have one formal sit-down mock exam as well in an exam room under exam conditions, and that's just to give them that experience to make sure they get a real feel for, you know, what it's like to sit a 2.5 hour core exam paper, and even do like a mini employer set project. And we look at a project-based approach as well, so giving them project-based examples to get them used to how the employer set project is structured, so that when they're working through the tasks, they can actually familiarize themselves with the actual assessment methodology, and getting them comfortable with long style answer questions as well. And that's where embedding English, maths and digital skills is really useful, because they are going to need to be able to write, you know, in some cases evaluate, you know, the keywords evaluate, describe, analyze, describe, and be able to go into detail and provide the evidence to hit the higher grades. So it's just exposing them in a variety of ways is my advice.
Thank you. That was fantastic. Really great. Thank you. Rosalind's asked a really great question. I'm going to let everybody else pop this in from a chat point of view. Where else do you get your questions, or how do you maybe create your own exam questions? If everybody could share that in the chat from both our speakers and those that have already, how they've created more questions. Because Rosalind's right. I mean, we've created multiple sample papers. We've got 2 sample papers now, and of course we are also limited by the fact that there's only so many assessment series that there have been. So at the moment we haven't got that plethora of questions, so the onus is on you as providers to think of creative ways to get exam questions. So definitely share in chat so that Rosalind can explore more ways to get exam questions for her students. So thank you for that. Now I'm going to move on to Philip Chrich. And he is from Birkenhead Sixth Form College, and he is going to share his experience in regards to the delivery of the T Level Science. He has great experience in FE, over 10 years experience of teaching, and he delivered the Laboratory Science OS, and I think he's got some great insights that he can share with you as a whole around the T Level Science. Thank you.
Hello everyone. Tracy, I think I've got like animation, so if you just want to reveal the whole slides rather than me saying next bit.
Yes, absolutely.
So I've got 10 years experience taught across Key Stage 3, 4 and 5. I've been at Birkenhead Sixth Form College for 4 years, and I was involved in kind of the launch of the T Level in science. We originally thought that we were going to run the T Level Health as well, but that hasn't happened, unfortunately. And I've also been, last year I was examining on the OS Laboratory Science. Now, I cannot say enough, if you do find the opportunity, like on the NCFE website, there is always, well, quite often examiners opportunities. If you can get onto marking on either the OS or the ESP or the core exams, then absolutely do that. It's I've always said marking, for example, is the best CPG that you can do, and it just has really helped us this year with the kind of teaching and planning in terms of the occupational specialism. So if you, next slide please, Tracy, thank you. So we've got 18 students in total, so it's not a huge cohort, but it's been really good for us to have such low numbers of students so that we can kind of really get our teeth into the planning of it and things like that. So we had 7 in our current year 2 and 11 in year 1, and we were hoping that our year 1 uptake would be higher than that, so that we could split it over into 2 classes, but we weren't able to do that, which meant that we've actually this year had a single combined class of year 1 and year 2, and we just thought we'd trial that, and if that was somewhere that you were thinking of going, I would just say don't do it. It's been quite tricky, kind of balancing the occupational specialism alongside the preparing for the core exams, as well as having 2 separate years of students on placement at the same time. So yeah, keep them separate if you can. Sorry, next slide, please. Tracy. So in terms of our industry placements, we've had such a great experience with the industry placement. The Liverpool area has been a hive of laboratories within pharmaceuticals and things like that for years, and so we managed to get a lot of people on board. So we had people like, we've got Unilever on our doorstep, AstraZeneca isn't far away, their virus lab in the University of Liverpool. And if I was going to say, if you can get involved with your local universities, they are really keen to get students on placements in their teaching labs and things like that. And there is actually a big drive coming from the DFE in the government, and they are trying to work more with universities to kind of help them to link with colleges that are delivering T-level. So one of my ex-colleagues is currently working for Nottingham University, who is trying to link placement employers with colleges that are developing T-levels and are planning on running it. So yeah, so local universities are a fantastic place to develop those new relationships with employers. Just some lessons that we learned in terms of industry placements. If you are new to delivering T-levels, I cannot recommend enough getting or hiring a placement coordinator. If you're planning on delivering this and having the teachers kind of support the placement, it is very admin heavy, the industry placement, and I realize this isn't directly linked with the NCFE, but the so trying to get somebody helping with the placement and planning the review meetings and things like that, I cannot stress enough that it really helped us out this year. In terms of paperwork for placements, the government website is quite tricky to find everything, but I've spoken to a couple of people, and that is improving or going to improve. And in terms of monitoring, what we thought was really helpful to actually take part in the meetings with the employers. We thought it was really useful to have the teachers kind of be responsible for a certain number of students, and then they ran those meetings, and so it just allowed you to see kind of from a teaching perspective how the students are getting on in placement. It just was really, I had some of the most lovely conversations with employers that I've ever had in my career, and it just is so nice to see your students really thrive in the working world, because we're used to them kind of leaving us and then they go and thrive. But it's that was one of the absolute highlights of teaching on the T-level. Sorry, next slide please, Tracy. Now, in terms of the core component, which involves the Core A, Core B exams and the ESP on science, I would say that the specification is split up into B1 and B2. This is for science. I'm not sure how it is on health and healthcare science, but for science, I would say teach Core B1 alongside B2. The topics they do follow on from one another, and it's kind of a good thing to do to split up, have a real look through the specification first, and teach the concepts that are in B2, which is the like the additional science concepts, alongside the same topic in B1. Definitely best thing to do there. Now, in terms of Core A, we just did a simple split amongst teachers. So we separated the teaching into the different sections that were on the paper. So we had, like, for example, one teacher doing a paper at section A, which is a if I remember, sections 1, 2, and 8. You have to look at the specification to understand it. I'm not going to go into it in too much detail, but yeah, absolutely split the core A into the sections that are on the paper. I think is best to do. It's also best for like accountability and things like that. So that's just kind of what we had as our split. If anybody needs me to go through that in more detail, I can do, but that's just how we ran it. I'm not saying that that's the best way to run it, but we felt that that worked for us, because you've obviously got core A and core B, and different people have got different specialisms in terms of the sciences. So that's just how we felt it worked best. So having a biology, chemistry, and a physics teacher, and then somebody who was just teaching core A. Next slide, please, Tracy. Now, for our ESP, we felt that this was best taught as skills rather than the ESP tasks. The ESP tasks came later for us. So it's skills that included things like writing a literature review, planning an investigation, carrying out data analysis on Excel. Now, students are notoriously not very good at this. So having some real dedicated time on how to analyze data, what to look for, patterns, things like that, that is really, really important, because the data analysis task for the ESP is worth a big chunk of the marks. Making scientific posters, so setting time aside, you know, like to model these skills and give them a chance to practice them prior to the ESP, and then things like presenting, group discussions, and just as a reminder, those presentations and the group discussions are filmed as well, so getting students comfortable being in front of the camera, in front of the camera, and then evaluating as well as part of task 6. Now, once you've taught those skills, we then introduced the scenarios, and we carried out a full ESP mock. If you can do this, absolutely do, because it allows you to, you know, get students to have some feedback and also iron out any issues with IT. We had some issues with like links not working for the literature review, absolutely. Now, the exemplar materials on the NCFE website, extremely helpful, and like Caitlin's just said on the chat, definitely use those before you do a mock. I would actually probably go there first to kind of navigate your teaching of those skills. What are they looking for? And like I say, doing it this way, we had some really, really good success with the ESP. Last year, our average was, you know, almost all of our students got a grade A on the ESP, which was really, really fantastic. Now, my final kind of tips for delivering the core component is to do with the core exams, and this kind of links in with a little bit of what James was saying about just preparing them for the exams. I would, if I were you, focus heavily on the command words. Those big 9 and 12 mark questions, plus the quality of written communication, really do spend some time teaching students how to structure their answers for these, because at GCSE science they would have only been looking at 6 mark questions, and then we're introducing these longer answer ones. They're also quite heavily linked in with the assessment objectives. So if you haven't looked in detail at these, have a look at these as well. And just as a loose structure we used for these 9 and 12 mark questions, paragraph 1, we kind of taught them to do a little bit of a brain dump on the topic around the question. And then paragraph 2 as an application of knowledge to the question. And then paragraph 3 really depends on what the command word for that one is. And for any students who struggle with English or don't have the grade 5 in English yet, that are retaking, obviously before they finish the course, finish their second year, the exam support pack, which is on the NCFE website, is really helpful, because it's got some little tips and tricks about you know, punctuation, spelling, grammar, that kind of thing in there. So that's a really good place to look. So I've gone through quite a lot there. If anybody has any questions, then please do not hesitate to ask, and I will share some more of my insights with you. thank you so much for having me today.
Thank you, Phil. Thank you. That was really, really great. Yeah, absolutely fantastic. I like the, I know you said, you know, placement isn't under the remit of NCFE, but for me, as who supports providers, I do try my best in NCFE best to understand all the ups and downs of placement, because at the end of the day, it does impact you as teachers and then impact your curriculum teaching and learning. So for me, it is a whole package. We are here to support you as a whole package, even if we don't manage the actual placement side. I think that's really key, and I think you have to look at it as a whole package in order to support teachers really effectively. And it's great that you showed that it is a whole package. It's not just the exams, which is really nice to see. Caitlin has a couple of good questions for you in the chat, Phil, if you can pick them up. So one around where they've done a couple of lessons where they've had year 1 and year 2 together. So if you have any insight on that, or maybe thoughts moving forward where you said where it was completely combined as a whole, didn't work successfully, but actually thinking, is there specific areas of the content in year 1 and year 2 where you could maybe combine as a class because it's relevant to both years, I think is where Caitlin is coming from. And then did students with grade 4 resit to get a grade 5 in English as well? So definitely share those insights in the chat for me, please, Phil. I would like to know is, what are the most effective formative assessment strategies you've implemented in T levels? Because I know a lot of you have moved from a vocational qual where that unit-based assessment has kind of supported that continuous measurement of progress for you throughout the year. So what great strategies have you used for formative assessment to prepare your students for the end of year assessments? So please do share them in chat, and then hopefully we can get some teachers inspired and go, oh, I never even thought of that as an idea. So with utilising of the textbook, so chapter questions in the Hodder textbook. I imagine, is that the Hodder textbook, or are those our scientists as well? I imagine maybe utilise, so yes, but I imagine as well from a science point of view, there is maybe practice questions that you can get from your old textbooks around biology or physics or chemistry that might support that real world application as well as vocational application. Mock tests, pop quizzes. They have the answer copies as homeworks and then answer blank copy as a starter. Oh, I like that one. Yeah, definitely helps with that AO1. Fantastic. Full mocks, workbooks. Oh, so you've used like report, professional discussion. So you've utilised like the tasks of the ESP as a formative assessment. I like that idea because they are great ways to formatively assess presentations, discussions, that sort of side. And then it also helps you build that skills and development for the assessment, which is really fantastic. OSCE scenarios, definitely for those that are not from a health background, that's kind of like the way the role plays are set out, or for those that are new to T-level health but don't know it from an HE point of view, it's kind of like the assignment 2 where everything's in a station and they rotate around doing a practical skills demonstration. A-level questions from a knowledge point of view, yes, so definitely picking out some of those A-level questions for your science content, I imagine, which is great. Gap tests, case studies, using learner journey as a starting point to measure skills and knowledge and behaviours. I love that you've got behaviours in there. Definitely, we should know where our professional behaviours are of our students, and then how they can then build those behaviours. I really like that. Kahoots. Yeah, I like that. Kind of like Slido. I've always liked a little bit of a quiz and a poll, and it gets the students engaged off the pen, off the paper. They get to play with their phones if they're lucky again as well. Sanctioned phone use. They love a sanctioned phone use. Thank you. So those are all really great strategies. And I think that's the great thing. You can be adventurous. You can be really adventurous with your formative assessment and explore lots of different new avenues. Fabulous. I will share all these and I follow up with the slides as well. So don't worry if you've missed any of these. Okay, so now I'm going to move over to Kieran Fowler, and he is going to share his experiences from the Eastern Education at West Suffolk College around T-level health. Thank you, Kieran.
Okay, afternoon everyone. So yeah, my name's Kieran. I'm the subject lead and head of Health and Applied Science, and we currently run the T-level in health. We have currently the nursing and the therapeutic pathway. With the idea of we've already started advertising for the transition into the midwifery one as well. So fingers crossed, hopefully we'll have 3 of them going. But yeah, if we begin, I'm going to start with the positives on the next slide, and I'm going to try and think of some of the other ones that obviously haven't already been discussed, because it's nice to hear that some of our positives are also being shown through other colleges. I think one of the biggest positives for us has been that we have noticed, and external stakeholders, hospital and other employers have really noticed how more competent our students are, as opposed to our BTEC students. So we currently work with two local hospitals. We work with West Suffolk Hospital and Addenbrooke's, and some of the feedback we had recently was how much more competent the T Level students are and how much more confident they are when they are going out onto their placements, because we're able to give them real life scenarios and be able to get them prepared for what the workplace looks like, whereas the BTEC course has not allowed us to get that opportunity for them. So that was some real nice positives that we've seen recently from our employers, is that actually the students seem to be more prepared for when they're going into those next steps. I think one of the positives has been that those exams are at the end of the year, therefore they allow that timely manner to allow us to get them fully ready for those. And equally, it's our work placements that people have highlighted already. But again, those work placements are going to be the real thing that are going to help those students get ready for those assessments and everything that entails for the first year and second year. Some of the other positives I didn't include, but obviously thinking about and listening to other people's, we also have had all of our second years who finished their placements. We had 10 of them. They've all got bank work at the end of their placement, and they were fortunate enough that they were able to work with the hospital in the initial training sessions to complete their care certificate. So the minute that they actually finished their placement, they had already completed their mandatory training, and they've also completed their care certificate. So it's something that I think, if you are thinking about opening up a T level in health, or if you're working with employers already, it may be something that you may want to think about looking to explore the care certificate, seeing if it's possible for them to get the care certificate going early on. It then allows those students that real opportunity that when they are ready, they can go straight into those placements. And that also then allowed us to see how much more, again, competent they became in their second year, because some of them, depending on age, were fortunate enough that they were not only had done their placement, but then they stayed on at their placements, and they were actually doing obviously I can't say what the practicals were, but they were doing the practicals naturally week in, week out, which then meant when we asked them to do them for their second year assessments, it was like a duck to water. They were able to instantly know what they needed to do. So hopefully we should see some good results off of them. Another thing that we did quite nicely is we hold monthly health clinics within the simulation suites, where it's open to the entire college, where staff members, students can come and they can practice their blood pressures, and the students then allow the opportunity to practice. So our open health clinic, to start with, didn't seem to take very well, and it was one of those things that we were thinking, oh, is this never going to take on? But it now receives there have been scenarios where we've had queues of people waiting, which has been quite nice, and it obviously gives those students those opportunities to really consolidate what they've learned, but not have to do it on them friends, actually have to do it on people they don't know. And obviously that when works with what people are saying about this group teaching. We do have our year ones and our year twos group teaching when we get ready for the exams, because the second years and the first years do need patients to practice with, and therefore it's quite nice when we get the opportunity to get them to practice. So yeah, there's some additional positives that we've found that people haven't maybe spoke about yet. So I'll just pop to the next slide, and the next slide just gives you a breakdown of what our first year currently looks like. So at the minute we've got 28 students, and again, I think the biggest thing is advice is to really ensure that you've got that adequate time in to prepare the students for the exams. I've given you a breakdown of what we've got at the minute. So we've got 10 hours of teaching on core A, 10 hours of teaching on core B, and we are very fortunate that we have 3 nurses, a midwife, a physiotherapist, a physics teacher, and a microbiologist. So we have quite a range of experts that are able to really bring their knowledge together, and it does allow us to really tackle the core A and core B nicely together. But I think the one biggest feedback that I would say and top tip would be, we didn't necessarily focus on the ESP. last year that much in terms of from week 1, but this year we decided to implement into weekly teaching. And basically from week 1, they are practicing the ESP. We actually asked the students to complete their summer work around the ESP. We actually give them one of the ESP case studies, and their work before coming to the college is actually practicing, getting them already thinking about what case studies look like. And from day 1, we then start with the layout of the ESP. So I'll just pop to the next slide. For obviously those of you that are running the ESP, you kind of obviously will know this, but those of you that are thinking about it and not really sure what's happening, it is a 5-patient scenario where they will pick a patient and then follow the patient through a series of tasks. So what we do is we devise a weekly session of, we practice report writing, or we will practice role playing, and at the point of when we were ready to do the ESP, we had actually gone through this whole project 4 times over. So they had seen this 4 times, and we had actually been able to assess this 4 times over. Therefore, they got 4 feedback sessions on how they were doing on their role plays, how their healthcare plans were going. And again, it was something that we have noticed that we haven't obviously got the results back for the ESP yet, but we noticed that the students felt a lot more confident than what our previous cohort did, because again, it became so natural to them. I'd like to say that some of them probably were bored by the time they got to their ESP, because they had done it so much. They had practiced their role plays so many times. Hopefully it's worked in their favour. So I think it is a strength, and I think it's something that I would definitely, it's something that we factored in for this year again, to teach the ESP from the very first week, get those core skills. But also at the same time, it does help with the practicing for the exams, because writing a report, writing a healthcare plan, they do require academic critical thinking, and therefore when they're practicing their long answer questions for their core A and core B, it does all equally allow them to really focus and rein in about how do I write a good structured question to that. So yeah, just a little bit about the ESP. So if I just pop to the next slide, which is our 2nd year cohort, again, our first year, so when the first year students go out, they go out on a 2-week placement, and that really helps them with their ESP. But then in our 2nd year, we do a 12-week industry placement at the start of the year. The students come to us for 1 day a week for us to check in on them, but for the rest of the time, they are out in their placements. And as I say, as our 2 work placements are our 2 local hospitals, West Suffolk Hospital and Addenbrooke's. We have been fortunate for the last 2 years, but I'll discuss why it might change next year. But we have rotational placements on preferred wards. So we do understand that if they have picked the therapy or the nursing pathway, they do need to see elements of those career specialisms, but at the same time we want to give students the experience to really rein in on as many skills as possible. So we develop a workbook with both hospitals on the mandatory, what we would like every student to be able to do and be able to leave the hospital be able to do, but at the same time we then have a nice rotational placement that some students have been able to complete. I think the biggest tip whilst the students are out on placement is that key part of being a reflective practitioner, and obviously that final assessment in year 2 is a professional discussion, and obviously their portfolio that they can take into that, it is crucial to have as many reflections as possible. So getting students to really reflect whilst they're out on placement is it's really crucial. But I think it's not just the reflecting, it's the actually reviewing and applying it is really, really crucial. And that's why we bring them in 1 day a week whilst they're out on their placement, so we can do that with them, that we can reflect, review and apply with them. So on the next slide, I just gave a very brief example of what something looked like for us when it comes to placements. These were just 5 random students, and this was shows you 9 weeks worth of placement that they did. And you can see that we were quite fortunate when we worked with the hospitals that we were able to get quite a variety of placements for the students, ranging from adult nursing, day surgeries, physiotherapy, cardiologies, renal wards. It is obviously quite a nice template, but unfortunately I don't think it's going to be possible this year because our numbers are scary high. The hospitals have already said that they are struggling. I went and fed back to them last week, and they said, what do your numbers look like for next year? And I said, we have 77 applications for next year. So even if we recruit half, it's still a lot more to what we're used to. So it is going to be something that we might have to change. We have explored with the hospitals whether we can do almost like a half and half, where half the students come to the college for the first 12 weeks, they learn, and then the other half go out to placement, and then when they come back, the others go out. It's something that we're toying with the idea, but it does make us nervous because that means that some students will go out, will be taught, then go out on placement, and then have to come back to the assessments. But we've also looked in the idea of, obviously, can we also go away from hospitals? So we're working with local primary care services, our GPs and things, to see if we can get students into there. And it is something that we have explored. It is something that we've been met with some resistance with primary care. It has not been very easy to get students and stakeholders interested and intrigued to possibility of taking a T-level student, but obviously it's something that we obviously are going to have to keep doing and growing, and equally obviously that's putting our reservation on obviously opening up more pathways at the minute, because I think that's one of the biggest challenges. And I think if we go to the next slide please, Tracy, I think it's the challenges that I talk about, is that we are getting more and more concerned that the more and more we're growing, it's not resistance to do with anything other than they can't facilitate, but we can't keep growing the T-level without employers being willing to take our T-level students on. But equally, as some people have already highlighted, I think if you haven't run the T-level before, please do not underestimate the amount of time that some of these take. The ESP is a very, very challenging experience. I said here, for example, the 28 students role plays took from 9:15 to 4:30, and staff had a 15-minute break for the whole day to try and get all of those in on that one day. So it's very, very, and that was with 2 staff members being the assessors and 2 staff members playing patients. Now, I think a positive to that was the experience that we took is we actually got our hospitals to collaborate with us, and our hospitals' educational teams played the patients for us. So again, that was quite nice because they came along and helped us with the idea of looking at how to play patients, how to work with us with those patients. Because again, those patients need to have background knowledge around the subject matters, because although that you get a script on what you can say, you do need to have the ability to know what the students are asking. People have already previously highlighted the limited exam papers. That has been a challenge for ourselves. And as I say, we've been using ChatGPT to really be working for us to help us with those exam questions, because we are limited to the amount of questions we have. So that's been something that we've used this year, and it has been really beneficial and equally not time consuming for staff. But also, again, some of the challenges working with the second year assessments, just like the first year assessments, they are quite big in terms of needing the requirement of potentially lots of staff. There are some scenarios that require more than 1 staff member to be involved in that, and therefore obviously that needs to be factored into when you're doing your planning. The biggest thing as well is also the timing. Obviously, I believe it was that the year 2 assignment 2 was happening, and then the ESP happened straight after. So again, it was that you had to annotate your videos, but also prepare for the ESP. So it is something that we had. Just to highlight, the hospital didn't play the patients. Maybe I shouldn't have said that like that. The hospitals just came in to help us with the consolidation of how to best play the patients. Us as staff members still play patients, but the hospitals came and worked with us to figure out how we could best play the patients to ensure that then the students get the best feedback from us. And then, yeah, so overall, it has been a really positive experience, and it's been something that I think is amazing. And I think that it's best preparing those students for the success. Of our 10 students, 9 of them applied to university and 9 of them have offers to university. So again, it was something that equally we were a little bit concerned about with how well accepted are the T levels going to be at university, being our first cycle of getting students to university. But we have had the offers, so hopefully the results will be there on results day for them. I think small placements in the first year are really, really positive. and make sure that you really consider a small placement in the first year to really help them with their knowledge, preparing them for that ESP. And I think making sure you use those materials that people said on NCFE's website. I think one of the big documents that I think is really important to draw people's attention to is the tutor guidance that gets released. That's really important because that gives you a lot of information about what the year looks like. For example, it will tell you the list of the practical activities, and it will point you in the direction to what the CPA outcomes look like. So it will then give you a rough idea of where the practicals are going to lie. And it gives you all the information for that. So I think whilst the materials have been limited, I think the materials that are on there are fantastic for better, not just new providers to use, but I think it's a fantastic amount of resources we've got on there. And just as we've said, it is new, and hopefully it will just keep building and building, and there'll be more and more resources. So yeah, thank you for your time.
Thank you very much, Kieran. That's really great. Really interesting. Two great insights to pick out there. I love the idea of doing sort of an initial assessment stroke task for the students. I think that's really good because it's almost before they start, you can set that beginning, where they're at the beginning, and then you can look at targeting them and improving them. And I think it helps with that right student, right course assessment as well in that first 42 days, that you can have an initial idea of where they are and then measure their progress and make sure they are on the right course for them as well, because we have all had that interview where they sound like a fantastic student and that's what they really want, and then once they're on the course, sometimes that's not always the case, or they've just sort of gone, yeah, that's a good idea, I think I'll do that, and it makes them ready to be on that course as well. So that's really great. Thank you for sharing that. There's some questions that have come up in chat if you would like to review them, Kieran. I think they're more from a general point of view, but actually I think someone else has answered them, so that's really fantastic. So just keep an eye on the chat there. Kwabena is our next person who is going to explore the healthcare science. So he is going to share his experience from healthcare science. Kwabena, are you okay? Are you there? So Kwabena is from Newham Sixth Form College, and he is going to share his experiences of delivering the T Level Healthcare Science. He has a fantastic science background, and he's going to which is common for our healthcare science teachers to come from a science background. So he's going to share how he's managed to bring that to the healthcare science qualification. Thank you.
Thank you. Okay, my name is Kwabena. So I've been delivering healthcare science qualification for the past 2 years now. During our enrollment, obviously we have students from some from A-level background. Those students who were enrolled on A-level and now they change their mind to come to T-level since they require technical qualification rather than going on to the academic route. So we had about 30% of them from the start. So that's our first batch of students. The rest of them were all GCSE students. So our entry requirement was grade of 5, including maths and English, and then science. So we were able to recruit 12 students for the start. And then it got to a point where 2 of them dropped out. We started the course without textbook. However, we were, relying on the resources that NCFE have published on their website. So we over-rely on them. And then we were also going according to the specification in that chronological order. That is core A and then core B. So we just make sure that nothing is left behind. Otherwise, student may be disadvantaged if that specific topic is not covered. Yeah, let's go on to the next slide. So we requires a few equipment. The beginning of the course, we have to purchase some few equipment just to make sure that the equipment that is in the specification, we have actually purchased them for the student to get their hands on to practice. So we bought some laboratory equipment like microscopes with various permanent slides. So obviously, like bacteria slides, amoeba, and so on. We have petri dish. I mean, in terms of what we call growing bacteria and so on. We had urine analysis strip. So those strips that are in the hospitals to check the urine and so on. We have blood glucose meter. So all these little equipment, we bought them just to ensure that we are fully equipped, ready for the course. We were fortunate to get the mannequin, which is usually expensive. We got the mannequin in our clinical skills hub. So that also helped us a lot. So the students go in there to practice their clinical skill stuff. We bought a few equipment like we also bought few equipment like the peak flow meter, digital spirometer. We have a micro pipette. You know, all these little equipment were purchased just to ensure that the clinical experienced students are experiencing them out, as well as the theory classroom learning. So yeah, we were able to get all these equipment ready to start. Let's go on to the next slide. So so delivering the content at the start, we had 3 teachers. Obviously, the A content, which is from A1 to A10. So what we did was, among the 3 teachers, we selected which areas we think we are very confident and comfortable with. Then obviously the B content, we have the B1 and then B2. The B1, which is biology, chemistry, and then physics. We have the physics content as well. So the biology content, we have the B2, which is usually only biology. They're a bit difficult stuff in biology. And then the B1, what we did was, because there were chemistry, biology, and then physics, so the biology teacher obviously was dealing with the biology, whereas we had some other teachers on the other courses to support with the delivering of the physics content. They are not many. The chemistry content is also not many. So, you know, we timetable them for them to use like 4 weeks to deliver those content, just for us to make sure that those content are covered. But then, as I said, the B content, biology forms about, I think 70%. And then we had the employer set project. In fact, when we began the course, the employer set project, we dealt with it at the later part of the course when the exams was nearer. But this year, it's not going to be like that. We have a way of resolving this. We left it too late, you know. But at the end, I think we got the student to practice more papers for them to get them ready to do it. Yeah. And let's go up to the next slide. Yeah, and then also we visited so many places of interest. We had a chance to visit the National Genome Center in Hexton near Cambridge. The student experienced the lab. They were experiencing so many things. So the stuff that they have learned from the classroom, they have to put it in practice over there in the Genome Center. They really enjoyed this visit. So what we did was we were able to include our T level transition onto this trip, so that because the number, the level 3 numbers were only 10, so we included the transition learners to go with them, for them to also experience the Genome Center. I mean, which is part of their course. It's part of the B content. So going there to learn extra stuff at the Genome Center. I think I will recommend it to the healthcare science and even the health, since it's part of their specification. So we went there to experience a lot how DNA and then the genome works and so on. So it gives students a lot of experience when we went there. They were so excited after. The next slide. So then we went to the Super Lab. So the Super Lab is at the London Metropolitan University, one of the biggest lab in Europe. So when I was planning the curriculum, I just make sure that all these areas that the student can experience their can experience anything, we just put it on our plan so that I write to them to make sure that we visit there for the student to experience. Because in the A content, the student have to, learn about the standard operating procedure. They have to be learning about health and safety and legislation. So all these things, when the student practically go there to experience the various stuff and ensuring health and safety and so on, So we extracted the DNA. The student have to make aspirin, a headache tablet, just for them to, experience the stuff from the area, and then also to enhance their practical skills. The student really enjoy all these things because not all other programs had a chance to visit the Super Lab to experience this. So the T-level learners were blessed to have this experience from the London Metropolitan University Super Lab. Yeah, so yeah, let's go on to the next one. And then also we had our placement with a trust called Bard Health. So this trust, they have 5 hospitals, if I may recall. 5 hospitals. One of them is Newham General Hospital, which is much closer to us. It's very, few meters from my college. We have St. Bart, we have Mile End Hospital, we have Whipps Cross Hospital. We also have Royal London. So our students were placed in one of these hospitals, but majority of them were in Royal London, which is one of the biggest in London. So what we did was we placed them into various departments according to what they need. Some of them went to the renal department, renal technology, medical devices. We had some who went to the lung function department. There was few students who went on to the cardiac physiology department. We have some few students who went on to pharmacy department. So according to their needs, we were able to provide it to them. However, about health, what they are saying to us is there's a lot of challenges in this. They're not giving us the health science any placement again because of the fact that they prefer the nurses. So those on health program, T-level health program, they want more of them to join to join them. But then the healthcare science, they closing their doors to us, which is a bit a shame. But for the health science, for the health, T-level health, they are willing to, accept them on the placement. Yeah. So the next slide. And then we went on to the assessment. The core exams is conducted by our exams department in the college, whereas the ESP is done by the curriculum. Task 4 is obviously a video where the students have to present and so on. So the task is broken down into sessions, 5 sessions. Obviously, task 1 is the literature review, and task 2, we call it the quality improvement report. And then we have task 3, which is all about student discussion and feedback. And then task 4 is presentation. And then tax 5 obviously is the tax 5 is, I think, the reflective account. Yeah, tax 5 is the reflective account. So yeah, the students really enjoy. In total, we use about 17.5 hours to complete this assessment, the ESP, which obviously the tax is broken down into sessions. First day, 5 hours, which is the literature review, and then obviously the rest of it is 2 or 3 hours for them to complete. And then also we have the OX exams, the OS, which is the Occupational Specialism. Students did enjoy these exams. Assignment 1 to 3, they are all videos. We video the students as they carry out the process. So what happened is we video them throughout, and then after we have to send the evidence to the NCFE exams board. The 4th assignment is a written task which the student have to write their response, and then we send it to NCFE. But the difficult bit is because of the size of the videos, we have to obviously shorten the video, not shorten it, but to make it in such a way that we can upload them. It is one of the challenging tasks that we face, because it was taking me day and night to download, and upload videos. And I think I sent, for the 10 students, I sent over 300 different evidence to the exams board, to NCFE, because apart from the video, there are other stuff that we have to send to the exams board, like the patient details and all these things. The links stuff, we have to send it to the exams board. So yeah, the only challenge is the uploading of the video. They were too big, and it takes us a lot of time. So maybe in future, if there's a way of assessing the student, whether in the group task, instead of them doing it individually for us to video them, maybe we can set a group task for the student to do as we video them, so that the video will be much more lesser. I think, that will be my feedback if, this type of assessment is amended in some way. I would recommend that a group task is set. Thank you.
Thank you, Kwabena. That's really great insights. Just a few things to pick up, and then we're going to move on to NHS, and who's going to finalise the last 10 minutes talking about sort of industry placement. But yeah, absolutely, I think it's great the amount of experience that you've given your students for that year one to bring that context to life. I know it's something we discussed before, where you don't necessarily come from that vocational background, so you've explored lots of different ways to engage your student in that vocational world, which is really fantastic. And I think you've picked out some key things that providers are asking NCFE about, which you've shared. I know you've shared it back on consultations with NCFE around that uploading of evidence, the admin sort of side of it, and the recording side of it. And I know NCFE have taken all this into account. And I know this is a common theme that we're seeing across all EOs. It's not just NCFE, and we're all exploring lots of different ways to try and make this it's never going to be easy uploading evidence, but as easy as possible that we can make this process for you. So thank you for sharing these. Matt Holm and Simon Brown, an opportunity to share their insights from a T-level placement perspective. So I've got Matt Holmes, who is the NHS Sussex Integrated Care Board, and then we have Simon Bowen, who is the NHS Bristol, North Somerset and South Gloucestershire. And if you were at the Leeds event, gosh, was it last week? Yes, last week, for the Leeds event last week, you would have already met Simon Bowen in our health route as well. So thank you.
Thank you, Tracy. So it's just myself and Simon that are going to be talking this afternoon. Unfortunately, Kim is unwell, and hopefully that will help us get us back on track. So we're just going to run through just a few things around our placement and our role. So myself and Simon are both on this call. We're both industry placement coordinators for the Integrated Care Board. If you don't understand how the NHS works within each region, you can see on the map there's the Integrated Care Board, and underneath those, in each of those regions, there will be at least one acute NHS trust, one community NHS trust, and one mental health trust, where the NHS is divided into smaller organisations. So out of the 42 ICBs across the country, only 7 bids were successful to have an IPCO role as a trial in place for an 18-month period until March 25. Our core roles and responsibilities, ultimately, it's about raising the profile of T levels. We want to create partnerships with our providers and employers. Ultimately, we're looking to increase placement capacity, have a strategic plan moving forward to make this scale upable, and really to move on into the future. So if we are only in post until next year, that actually there is something beyond that, and hopefully a bit later on this year, we'll have a bit more certainty about whether this role will continue. Next slide, please. So just a brief overview of what's going on in Sussex at the moment. James and Kira spoke about what's going on, particularly in the west side of the county, but just from the health perspective and the courses that are being delivered. We've got 7 colleges, and we're going to have an 8th from September, delivering T Level in health, and we're projecting over 100 students from September. All 5 of our NHS trusts within Sussex are going to be delivering placements from September, and we've got many placements as well in social care, and we're doing a little bit better in the east of our county than we are in the west. Currently, we don't have any placements in primary care, and I think it was Kieran might have alluded to this earlier about the challenges we are having in primary care. And ultimately, primary care, even though they're part of the NHS, they're not part of the NHS trusts. They're run like very small businesses, and I think part of the barrier to that could be that particularly the Employer Support Fund, which hasn't continued, putting up a little bit of a barrier to placements within our NHS trusts. The image at the bottom there, I just want you to see where we've got in the purple circles are our NHS trusts, and these are the current trusts which have got colleges feeding into them. And actually, so if we take UHS, which is one of our trusts, they've got 3 colleges which are feeding into that trust, and they're delivering placements, which will feed quite nicely into the next slide. Okay. So some of the things which we're doing in Sussex is just trying to adopt a system-wide placement model. Like we said, I'm working with 5 NHS trusts, 7 colleges, which will soon be 8. So it's 13 organisations which are all working together, and they're all doing something slightly different, which was making it a bit of a logistical nightmare just from a pure admin point of view and keeping track of everything that was going on and delivery of the placements. So we captured the student voice, and ultimately what the students have said is actually that they would prefer to be out in blocks on placement because actually they feel more integrated to the team. They get a better variety of experience, and actually they can plan ahead because they feel like actually this is just a bit of time which I've got on placement, and then the rest of the time, because they've all got part-time jobs and things. From a college perspective, so they can plan ahead and they know when the students are out, and they can timetable this if that is the case. And I think having that certainty about when the students are out is really, really beneficial. So if you were to do an undergraduate course in nursing starting this September, you would know until 2027 exactly which week you're out on placement for the whole 3 years. So actually, I think it's a bit more planning ahead from that perspective. From the employer's point of view, it's a lot less admin all the colleges are doing the same thing with each of the employers. When you've got, if take for example on the previous side, you've got 3 colleges feeding into one organisation, and they're all wanting to do something a little bit different. This adds increased administrative pressures, which actually makes it quite stressful for the employers. And we can also got to think about, as the employers are operational organisations, they've got times of high activity within their trusts. So winter pressures, for example, they've got high times of high learner activity. So a lot of undergraduates might be out at the same time. They've also got things like junior doctors change over at the same time as well. So we're looking actually to move somewhere in between a day release and a block model. So we're going to try a hybrid model, which is 3 days a week, over 15 weeks of the 2 years, which will allow then the colleges to still have some contact with the students while they're out on placement, and also give the students all that kind of block model. We're also looking to implement a placement handbook, which is just going off for printing at the moment, which is just taking a little bit of time, but that's going to give guidance to the students, the mentors, the departmental managers and the education leads within the NHS trusts. At the moment, I'm doing a bit of work on non-clinical placements within our health service because, okay, nurses, doctors and our allied health professionals and healthcare scientists make up a huge proportion of the workforce, but there's also a massive amount of staff which are behind the scenes. So I've managed to establish some placements in business and admin, accountancy. I'm just looking at legal at the moment. Unfortunately, digital seems to be the biggest challenge I've got. We've got lots of IT services and support services within the NHS trusts, but unfortunately they're all working remotely and there is a limitation for how much remote working the T-level students can do. And obviously our health students remain the largest group that are going to need placement, so that's really where I've been focusing my attention. That's kind of a summary of what we're doing and what's going on and some of the work in progress. I'm going to hand you over to Simon now, who's going to talk about some of the work that he's doing in Bristol.
Good afternoon, everyone. Apologies that we're a little behind. I'll try and whistle stop. I won't go through all of my slides. I'll just give a bit of an overview. So we're a few years into this T-level journey, and really it took a long time to get to an established sort of standardized process. But I think we're not perfect, but we've got a system approach now that seems to be working. We've got a strategy where all of our providers in the region and all of our hosting employers follow the same placement model. We follow the same student preparation package, so every learner and every provider and every organization is having the same experience when it comes to T-level industry placements, which I think has really helped gain that buy-in and for me to increase the capacity that we're looking at. So a few years ago in wave 1 we piloted 9 students. We're looking at September to be hosting something around 100 to 120 clinical placements across our trusts and our employers. I think that the things that have really added value are the collaboration with the providers. I think we've got a regular stakeholder group that come together where the education providers share good practice, and that our education providers have always all been part of different waves, so there's been lots of learning and sharing, and that collaboration has been really effective. The same with our employers, and actually that group, our community of practice as it were, share ideas and make decisions for sort of future direction and strategy of T-levels and industry placement engagement for us. I think a big selling point is around that curriculum co-design and sequencing. For me, it's crucial that we have a really clear timeline of expectations about how, from my perspective, I set quite high standards to the providers to say we expect the learners to be at this level before they come to their clinical placement. And one of my slides, which will be shared, will allude to some of the things that we've embedded. But it's around about managing the expectations. All of our learners come in and they are productive from day one. They are undertaking healthcare assistant, healthcare support worker activities under supervision. So that's the stage that we get them at. The care certificate and e-learning for health and all of that pre-onboarding is embedded into year 1. Clinical placements start in year 2. To complete the care certificate in year 1, the colleges in our area have all agreed that the learners undertake a social care placement in the first instance, just to get that patient facing and get that care certificate competency signed off. If you go to the next slide, it will just indicate so some of the collaborative things that we've been doing about overcoming barriers. I guess if I could give advice to providers, T-levels are still quite new, and someone earlier in the call said, a penny for every time you had to tell someone what a T-level or an industry placement was. It's still evolving. It's still a growing picture, and whilst we've got some limited industry placement coordinators, that work is still a shared challenge. I would say scrap trying to sell T-levels and sell the students themselves. Those 16 to 19 learners that are fantastic and doing really great jobs when they're in placements, those case studies and actually they completely blow out the misconceptions around those young people in those clinical environments. We had those questions earlier on, and actually the feedback from the placements we've had more often than not has been incredible. They've blown any misconceptions about 16 to 18 year olds out of the water. So really focus on what the learners can really bring to the placement and how they're going to add value to that workforce. I think that's been really great for us. And if you flick onto the next slide. That's right. So this is some of the things. So we've created this readiness package. There's high expectations from us around what to expect, but we don't expect the college or the providers to deliver all of that. We come in and doing regular engagement days within the colleges. I get clinical staff to come in and do master classes and technical skills classes. We add value to the curriculum, and we are helping shape and mold our future workforce. We see this as a brilliant talent pipeline, and we really want to make sure that even those basics of professional behaviours and standards and those responsibilities are embedded into the curriculum. So what we come in and our clinical staff say to the students, we then expect our providers to mirror that. So when they're in their sim rooms, uniform standards are on point and everything is in as it should be, and that seems to be working really well for us. This, of course, it's a growing picture, and the numbers are growing quite exponentially. So from the 9 in the pilot year, like I said, to over 100 this year, it's quite a big growth, and we've committed as a system to place all of those students clinically across our employers. Now we're in a fortunate position at the moment to have a centralized coordinator, and I would encourage anyone to look at that as if that's the, that definitely unlocks some doors. I think that some of the gaps, and I've spoken to Tracy about this, I think that we don't really have a consistency of approach, and I've seen a range of providers talk today about all of their different approaches. I think that's brilliant, but I think we do need a more standardized approach to industry placements. I think that it's too variable. Learners are getting a really different experience across the country, and for me, the most important thing for us as an NHS is we want those learners to have a really great, positive, hands-on experience, and if we can get that right through that pre-onboarding and that collaborative working, then I think this provides a fantastic opportunity for all of us, and those learners get very clear progression pathways. From our first graduating group, 2 learners came on to R&DA apprenticeships with us within one of our hospital trusts, and the other 7 from that first 9 went off to university courses to study sort of variations and specialisms. But really positive. I think that the T levels are providing a great opportunity. Start those conversations really early with your employers. Sometimes it's about finding the right person, the apprenticeship lead, the widening engagement lead, anyone as a bit of a hook in. People are in the NHS are starting to really hear about the T levels. We're really pushing hard. I know it's not an easy thing to do sometimes. Having been in your shoes as a provider, a few years ago, I think we're pushing in the right direction. And as we see that scale up, whilst that makes me a little bit nervous about the amount of placements, given the complexity of the landscape that Matt has described, and be mindful of that. I think that there is some flexibility needed in there. We have, in one of our trusts, for example, there's upwards of 1,200 learners any one day, and students in that acute trust. So we really have to manage the balance of students and operational staff. But just working with your providers will be great. And I think that we've created sort of we're starting to create some skills frameworks and some learner workbooks that can go alongside and support and add value to that placement. But it would be great to see a standardized approach. That's it. I won't speak any longer. I'm happy to answer a few questions with Matt, if that's okay.
Yeah, so thank you very much for sharing that. I think you've picked out some key components there for industry placement. I think providers being mindful that it is a large group NHS trust, for example, with many different students from many different places. I think it's also key to not give up and keep contacting and getting through and working with the NHS trust. I think I've heard that last week. I've heard this a lot from providers. I think it's great that you are exploring these challenges for our providers and trying to find the best possible routes and looking at different delivery plans, which is really great to hear. And I think the key is that regional differences that are even within region differences that our providers are experiencing, and it does sound like that you are trying to continue to grow that. And I think you're right, your students are your best evidence, and I imagine the reason that more employers are coming on is because you've already had students go through and showing what fantastic students they are and how it isn't just a work experience, it is a placement. So that's really great. Thank you everybody for joining us for today's session. I think we've had some really fantastic speakers. I will share all these slides with you so that you can pick up some of these links, and I know Simon and Matt's emails are on there as well, so you can reach out for them if you have any questions. I hope you've managed to take some key strategies, some key ideas, lessons learned with you back to your next stage of that curriculum planning, and utilise that to continue to give your students the best experiences possible. So thank you for joining us.